Well, dairy cows across the country will be tested for bird flu more closely now to stop the spread of bird flu.
New rules were put in place yesterday after the FDA reported finding fragments of bird flu in pasteurized grocery store milk.
Regulators, though, say there is very little risk to humans. There has only been one confirmed case. It was a farm worker in Texas, but UW Health's Dr. Jeff Pothof is here for his weekly visit with more. Good to see you, Dr. Pothof. These headlines are alarming, so it's good to have you here to sort of put this in context for us. What is bird flu?
So bird flu is a form of influenza like we get influenza, humans do, but it typically affects poultry or birds. We typically see it more in Asian countries. And in the past, when humans were to get bird flu, it's not actually easy to catch. Sometimes mortality rates were high, but these were in Asian countries. Healthcare systems were different. We almost never see bird flu contracted by humans in the United States. I think only a handful of cases over the years that it's been tracked. So largely not a problem for humans. It can be a big issue for the poultry industry, and then the impact to humans then is the cost of eggs and chicken go up.
So the health risks for humans seemingly pretty low then?
Yeah, relatively low. If you're severely immunocompromised, maybe you have HIV/AIDS, you come across bird flu, you catch it, you could get pretty sick. But even for people who catch it in the United States, illness is typically pretty mild.
I think the reason it raised alarms is because it was found in remnants of pasteurized grocery store milk. Pasteurization normally kills 99% of all viruses. Can you get sick if you drink this milk with some of the remnants in it?
No, so I think it's important to recognize that what they're testing for are like little pieces of genetic material that this virus has, but they're not finding complete virus. And then even when they take these genetic remnants and they put it in an egg and they try to grow it, which is the easiest way to grow influenza virus, it doesn't grow. So the milk supply is completely safe. It just has these genetic fragments in it.
Is there any type of vaccine or treatment for the bird flu?
So there certainly would be antivirals. We have like Tamiflu that would work. Our vaccines aren't specifically targeted to bird flu because we don't often see it. It's likely that we do have some cross-reactivity with our current immune systems. All the flu shots we've gotten, times we've got influenza, that would help us fight bird flu if we were like one of the unlucky people who managed to contract it.
So dairy farmers across the country now are going to monitor this more closely. I mean, is there a potential that it would spread rapidly and we have to keep an eye on it?
I mean, I think there's always a potential that bird flu could somehow mutate, and we would have a version that did easily spread to humans, maybe cause some disease in humans, but that's not the case right now. I think the bigger issue is if we have it in cattle and those cattle are close to poultry, does this create an increased risk for those poultry farmers if we have natural reservoirs of cattle containing bird flu?
Yeah. And so if it affects any type of products, how can people monitor that?
Yeah, I think right now just keep an eye on what the FDA is doing, but it's really unlikely, I think, that we're going to see any food product that has the chance of giving you bird flu. Now, the one thing I will say is it's Wisconsin. There are people listening who have easy access to raw milk. That's in their milk house.
And that is a concern.
A concern. It's always been a concern. High levels of salmonella, listeria, E. coli, but that raw milk, if it has bird flu, probably is full viral particles. You do risk the chance of maybe getting bird flu if you're drinking unpasteurized milk that has the virus in it.
All right, we'll continue to watch it. That's pretty reassuring, though.
You bet.
Especially here in the dairy state.
Yes, that's right.
Thank you, Dr. Pothof. Good to see you.
You bet, same.